Hi, I'm Melinda Tasqueta-Mullane, Editorial Director for Imaging Technology News, and we are here at NCoBC 2016 with Dr. Jennifer Goss, who is the President of the National Consortium of Breast Centers, Chief of Surgery, Women and Infants Hospital of Rhode Island, Director, Breast Fellowship at the Breast Center Director, Breast Fellowship at the Breast Health Center, and Associate Professor of Brown Medical School. So thank you very much for being here with us, Dr. Goss. We appreciate it.
Thank you for letting me speak.
Absolutely. And today, Dr. Goss is going to be talking with us about the state of the industry. So, Dr. Goss, where do you see the industry heading?
I think the greatest area of advancement in breast cancer treatment right now is our personalized medicine, which is our current catchphrase for really tailoring breast cancer therapy to a woman's individual diagnosis. And we're doing that by genomic analysis of each woman's individual breast cancer. This is a way that we can assess her tumor and really tailor therapies to target her tumor exactly and that patient's exact risk. That's going to let us get away from giving all women maximal therapy to save a small percentage by using that therapy, and let us tailor maximal therapy to those who need it, and lesser therapy for women who need lesser therapy. Still not compromising ever on overall survival, but letting us maximize survivorship outcomes for women. We're becoming much more in tune to the toxicities of our therapy, and we can even today screen patients who might be more susceptible to toxicities of therapy and then choose a different agent that might render them less susceptible to long-term consequences of treatment. So this, I feel, has been the greatest advance in the current era of breast cancer therapy. Again, not compromising on overall survival, but decreasing the morbidity of therapy. It's really exactly the same steps that we took in the 1980s when we considered breast conservation. That's what Dr. Veronese wanted to see, maximal outcome with less extensive treatment.
What are some of the trends in breast cancer surgery?
So I smile because what a segue that was. But so with Dr. Veronese laying the groundwork for us so many years ago, breast conservation has become the standard treatment. And what we've learned today is that we can tailor breast cancer surgery to a patient. We can optimize her outcomes so that she can have the best results. Now, what we've seen in the last decade is a surprising reversal of increasing breast conservation to more women choosing mastectomy and bilateral mastectomy. And what we're pretty certain of based on large data set analysis is that women who are making these choices in fact have early staged localized disease. There are women who are eligible for breast conservation. And to the best that we understand, they're making this choice for quality of life and peace of mind reasons. And while one can never judge what gives another person a peace of mind, it's called clinicians to better assess how we can use patient informatics to convey to patients what the consequences of their choices are. In other words, when a woman chooses more extensive therapy and doesn't affect her overall survival, we want her to feel crystal clear about what cost that increased surgery comes to her in her survivorship. The trends in breast cancer surgery have to date been less extensive surgery. We are very fortunate here at NCBC to have Dr. Giuliano present his data, and he shared with us that the 10-year outcomes of Z11 continue to confirm that the risk of local recurrence in the axilla for patients with node-positive disease, low-volume node-positive disease, but node-positive disease are equal whether they're treated with sentinel node alone or completion axillary dissection. So we see a vanishing role for axillary dissection and a decreasing role for bilateral mastectomy or unilateral mastectomy.
So, Dr. Goss, if people have would like more information, do you have a suggestion of where they could go to get some additional information?
There are many websites that provide good information. The one that I refer my patients to most frequently is breastcancer.org. But there are different websites that serve different needs. I know Force is another good website, and that's for women who are high risk. And the American Cancer Society, of course, has a very good website.
Wonderful. Well, thank you so much for your time. We appreciate it.
Thank you.